A nationwide investigation uncovers a growing problem with medical billing. It involves patients often charged thousands of dollars in surprise fees after going to an in-network hospital, even though they have health insurance.
KV Defender Andy Parati explains hidden cost in this buyer beware report.
If there's anyone as healthy as a horse, it's 30-year-old Heather Edwards. Other than giving birth to her children, the Marble Falls mother can't remember ever falling ill.
Literally, I never get sick, knock on wood. We're a very healthy household.
In October, though, her temperature jumped to 103 degrees, and it wasn't getting any better.
I felt miserable. I felt like I got hit by a bus.
Her husband drove her to the nearest ER covered by their insurance network. A doctor determined she had a viral infection, prescribed her antibiotics, and sent her on her way. She paid a small copay. 3 months later, she received this surprise bill for $588. It was from the doctor who treated her, who wasn't covered by Edwards Insurance.
I didn't go in asking or thinking I would have to ask that the treating physician would be in my network. I really did not think that that would be a question I'd have to ask. It's very frustrating.
A national investigation by investigative reporters at our KVUE sister stations has found Edwards' case is one of thousands across the nation stuck with surprise medical bills.
If you're in an emergency situation, you should never have extra bills that you weren't expecting.
Even though they pay for health insurance.
It's not right. They should say something to you.
Here's how it typically happens. You pick a hospital in your insurance network. You're financially prepared, or so you thought. Unknown to you, one of the physicians who treats you is out of your network, not covered by your insurance. The anesthesiologist who sedates you is also out of your network. Then that special tool the doctor needs to perform your surgery is not covered by your insurance either. A week later, you get a bill in the mail for all three. You've just been hit with surprise balance billing, and it's all legal. At least 24 states have some kind of limited protection to help consumers prevent or pay for surprise medical bills. A Texas congressman, though, wants a federal law to make surprise billing illegal in all states. In 2015, Congressman Lloyd Doggett of Austin authored the End Surprise Billing Act. If passed, it would prevent balance billing during emergencies, provide 24-hour notice of out-of-network providers, and provide consumers with a cost estimate.
I think when patients go out and they're responsible, they get insurance. In many cases, they check to be sure they're going to an in-network hospital. They ought not to have to foot a bill that is a result of a conflict between hospitals, insurers, and physicians. Industry trade groups like the American Hospital Association would not say whether it supports Doggett's bill. Instead, a spokesperson emailed us to say AHA supports a structured mediation model to help consumers, but that's only after patients receive a surprise bill.
Deductible copay coinsurance due.
For now, patients will continue paying the price.
Bacteriology.
For a system which doesn't allow them to financially plan for their health care. The Texas Department of Insurance can help some patients with charges after they receive a bill, but there is no state law preventing balance billing. To find out whether you qualify for state help, go to this story on KV.com. We want to hear about your surprise medical billing complaints. Also in this story, we've created this online form for you to tell us about your bill. Tyler Terry, back to you.